As some states start to open up and allow health providers to resume elective procedures and services, we have to ask a very important question. How long will it take to return to the pre-pandemic level of services? And will there be long-lasting negative impact to all of us? Let me provide some perspectives based on my research on the 2003 SARS outbreak. SARS is the first severe readily transmissible disease in the 21st century. It first appeared in China in November 2002. On February 21, 2003, the first case outside of China was reported when a medical doctor in the Guangdong province traveled to Hong Kong and then became ill. This was a super spreader scenario. 12 individuals staying on the same floor as the affected doctor in the hotel also contracted SARS. These hotel guests then spread the disease not only within Hong Kong, but also to Canada, Vietnam, and Singapore. WHO believed most of the probable SARS cases across the globe came from this super spreader in Hong Kong. However, despite extensive business interactions among Taiwan, China, and Hong Kong, only sporadic cases were reported in Taiwan between March and early April. This is largely due to Taiwan's rigorous port entry screening and the success of early patient isolation, contact tracing, and quarantine after report of the first case on March 14th. On July 5th, almost 5 months after the first case in Hong Kong, WHO declared containment of worldwide epidemic. The SARS epidemic resulted in more than 8,000 probable cases and nearly 800 deaths in more than 30 countries. The scale and the scope of devastation with SARS were nowhere near what we see with COVID-19. Nevertheless, SARS still caused widespread social and economic disruption. For example, schools, hospitals, and the borders were closed, and airlines had to cut 50 to 70% of their capacity to affected areas. People undertake extensive protective health measures, such as wearing surgical masks and avoiding public transportation and congregation. Our analysis of Taiwan health claims records during this period showed a universal decline in prenatal care visits by pregnant mothers during and immediately following the SARS outbreak. Prior to the first reported case in 2002, the average number of visits is 9.3 per pregnancy. This number dropped by 2 or 20% less visits during the outbreak. Even after Taiwan was officially removed from WHO's list of SARS-affected areas in July 2003, the average number of prenatal visits remained at this low level for nearly a year, and it took almost 2 years to return to the pre-SARS level. Avoiding prenatal visits has profound negative impact on the family and the society. There have been discussions among scientists on how much prenatal visits improve the newborn and the mother's health. And the SARS outbreak provided a natural experiment when prenatal visits were disrupted by a natural disaster. Specifically, we find that for every visit skipped, the likelihood of a birth complication increased by 2.5%, and it is 4% more likely that the newborn will have low birth weight. It is well established that low birth weight might lead to higher risk of infant death, childhood sickness, and developmental issues. Newborns with low birth weight are also more susceptible to a wide spectrum of chronic diseases in adulthood. Obviously, infants born at low birth weight not only impose substantial cost on family, but also on society in the long run. It is no surprise that fear of pandemic makes people avoid hospital visits. While every mother knows that she should not skip prenatal care visits, under the fear of SARS, they behaved very differently, having to take risks with their babies to avoid infection. As you can see, this kind of fear has far-reaching implications on a wide range of health issues. For example, Washington Post reported a couple days ago that stroke admissions in a New Haven hospital have plummeted 60 to 80% over the past month. New York Times reported a 40% reduction in emergency procedures for heart attacks in Spain during the last week of March. As we are planning for reopening our daily lives and returning to a new normal, we have to also think about how this disruption will affect people's health. Some of the problems are not obvious, but will have long-lasting negative effects.